Our zone is in strategic intervention at Mare and Pavuna, two violent and poor neighborhoods of Rio de Janeiro, Brazil, made possible by a partnership between UNICEF, Luta pela Paz and the Rugby League World Cup. This innovative and cost-efficient program has four main lines of action. 1. Building a community of care with child protection professionals. 2. Psychosocial support and mental health consultations with children, adolescents, and young people that also attend to sports sessions and employability workshops, using the Quarantine Diaries methodology. 3. Capacity building for young people from Mare and Pavuna to design, produce and share content on gender and masculinities amongst their peers. 4. Online campaign on prevention of all forms of violence against children. Most of the child protection professionals of these neighborhoods were reached by the community of care training, a methodology that takes into account both already established practices and new tools to ensure children and adolescents have access to quality services. By creating a community of care during the formation, these professionals could understand what care is really about through their own experience. Now they can improve their participation in the child protection network. More than 300 mental health consultations of 54 adolescents were carried by the psychology team. An innovative methodology called Quarantine Diaries was used with a brief intervention approach that offered quick positive impact on the children and adolescents attended and connected them with the wider protection network when necessary. The Quarantine Diaries methodology offers tools for monitoring how children and adolescents are promoting their self-care, building autonomy and ensuring better mental health conditions. The activities are held by a psychologist and, at the end of the cycle, a plan is designed so that he or she can continue his or her self-care. The success of its implementation has inspired a new law at the municipal level to spread it to other favelas in Rio. Two groups of 20 boys and girls were formed to discuss gender, violence and self-care. Both teams had lessons on these and other topics as well as media production abilities to design and disseminate information to engage other young people. A communications campaign designed to promote a community of care aimed to strengthen the local child protection services. A web series and a podcast were produced as well as social network posts that reached more than 20,000 people at Mare and Pavuna. Huge populations are in need of care at Mare and Pavuna. Their collective needs demand a collective action. By using low-cost and highly replicable methodologies that change child protection workers' perspective on the very definition of care, we've been able to strengthen local services and safeguard children and adolescents in their territories.